get a show of hands, who here loves their regulator? I know, right? I'm an endocrinologist. I'm an educator. I'm a patient, but I'm also a regulator. We oversee the continuing medical education enterprise for the nation's 940,000 doctors and are trying to create and customize better solutions to drive that educational quality. And I'm here because I need your help, because we need change. And we need change for several reasons. We know that people can learn. We put our kindergartners in school. I know doctors behave like kindergartens, not infrequently, but they are people too, and they can learn. But people want to learn. People want to learn because it sustains us, it reinforces what matters in our world, it helps us achieve our intellectual capacity. We have several dimensions of what it means to be human. We live in a physical world. We need to be loved and to love. But we also need to grow in our intellect, in our ability to express our intellect and make that matter. And ultimately, if we're able to bring those things together, we can leave a legacy and achieve some spiritual growth. So learning sustains us. It makes us better at what we do. It reinforces our humanity. But we're often disconnected from that very entity. Clinicians in particular can become complacent about learning. They can believe that having graduated from medical school, suffered through residency, fellowship, or nurses, or occupational therapists, or whatever clinicians you're talking to, can believe that they are knowledgeable, insightful, and they can become complacent about what they know. They can also be very easily distracted. Look at all of the things that are obligatory requirements for our nation's clinicians right now. All of the incentives that are in front of them to do things that are not about doing that thing that actually sustains them. They have many more choices in what they need to do, but very much declining time, and what happens in that circumstance is confusion and an orientation towards things that are potentially immediately gratifying. Those urgent things that don't actually lead us to what actually drives our ability to be better doctors, to limit our burnout, to help us work collaboratively, to share with each other, and to grow in our professional practice. When we do that, we sustain a culture of overconfidence, and we create clinicians that are often deaf to feedback. So we need change. And the regulator is at the bottom of this tier of systems that are designed to support quality in education, to reconnect our community with what matters, what drives them, what sustains them, through the educational providers we accredit, through the educators we work with, through the learners that meet that education, and the patients that benefit from ongoing lifelong learning. And there are two groups of people who can really help. The first are educators. Educators are often ignored, disregarded, they are not nurtured, they're not supported. But they can really help. You give them legitimacy, you give them support and a community, you give them tools and facilities, you give them regulatory freedom, they can work wonders. And of course, the other group that can really help us and help me are patients. Patients are key observers of the clinical encounter. In fact, they're the only clinical observers that really matter in many cases. But this is a picture of our conference from yesterday, where we convened here a pre-meeting about engaging patients in clinical research. And we heard patients need to be invited, valued, be safe, to be heard, to have their suggestions acted upon. But in that environment, they can and do make a huge difference. These are our regulatory requirements for commendation in our accreditation system, and we're trying hard to support the community, to reward things like engaging the patients and the public in educational activities. Do things like reward engagement of the community in evolving their own professional abilities and driving towards higher level outcomes. But I can't do things without your help. together, working together, listening to each other, learners, patients, the regulators, and the educators, we can create a new system that evolves beyond the knowledge transfer education of the past to an active, participatory learning environment that we need. We can restore meaning in work. We can promote self-awareness, create and sustain teams, create interprofessionalism, change performance, and improve patient outcomes if we reconnect with that education that really matters. So I hope that you'll think about reaching out to one of your teachers and celebrating them. I hope that you will think about engaging, if you're a patient in co-creation, if you're a clinician in co-creation and education. I hope you'll think about planning your own learning and being intentional about it and nurturing yourself through your education. And I hope that you will teach so that you will share what you know with those around you so we can benefit from the wisdom that you've gained. And if you do all those things, maybe you'll love your regulator. Thank you.